Certainly. Healthcare is one of the most promising and rapidly evolving fields where artificial intelligence, AI, is making a significant impact. Here is a more detailed explanation of how AI is transforming healthcare. Medical imaging analysis. AI algorithms are being used to analyze medical images, such as X-rays, CT scans, and MRIs, to aid in the diagnosis of various diseases. Deep learning techniques enable AI models to detect patterns and anomalies that may be difficult for human experts to identify, leading to more accurate and efficient diagnoses. AI can assist in detecting diseases like cancer, cardiovascular conditions, and neurological disorders. Drug discovery and development. AI is revolutionizing the drug discovery process by helping to identify potential drug candidates more efficiently. Machine learning models can analyze large volumes of data, including biological, chemical, and clinical data, to predict drug target interactions, optimize drug properties, and accelerate the discovery of new therapies. AI can also assist in identifying potential drug repurposing opportunities and predicting adverse drug reactions. Personalized medicine. AI enables the analysis of large-scale patient data, including genomic information, electronic health records, EHRs, and clinical trial data, to develop personalized treatment plans. Machine learning algorithms can identify patterns and correlations in this data, allowing for more precise diagnostics, treatment selection, and patient risk stratification. Personalized medicine has the potential to improve patient outcomes and reduce healthcare costs. Virtual assistants and chatbots. AI-powered virtual assistants and chatbots are being used in healthcare settings to enhance patient experiences and streamline administrative tasks. These conversational agents can provide basic medical information, answer frequently asked questions, schedule appointments, and even triage patients based on their symptoms. Virtual assistants have the potential to reduce wait times, improve access to healthcare information, and free up healthcare professionals to focus on complex cases. Disease prediction and early detection. AI algorithms can analyze patient data, including EHRs, lab results, and wearable sensor data, to predict the likelihood of developing certain diseases. By identifying early warning signs and risk factors, AI can aid in proactive interventions and preventive care strategies. For example, AI models can predict the onset of conditions like diabetes, heart disease, and sepsis, allowing for timely interventions to prevent adverse outcomes. Robotics and surgical assistance. AI-powered robots are assisting surgeons in performing complex procedures with higher precision and control. These robots can analyze real-time data, provide surgical guidance, and perform tasks that require high dexterity. Robotic surgery enables minimally invasive procedures, reduces recovery times, and enhances surgical outcomes. Clinical decision support systems. AI algorithms can analyze patient data and medical literature to provide evidence-based recommendations and support clinical decision-making. These systems help healthcare professionals in diagnosing and selecting appropriate treatment plans by considering a broad range of patient-specific factors and available medical knowledge. Clinical decision support systems can reduce medical errors, improve treatment outcomes, and ensure adherence to best practices. Remote monitoring and telemedicine. AI-enabled remote monitoring devices and telemedicine platforms allow patients to receive healthcare services from the comfort of their homes. These technologies can track vital signs, detect abnormalities, and provide real-time feedback to healthcare providers. AI algorithms can analyze the collected data and alert healthcare professionals to intervene when necessary. Remote monitoring and telemedicine enable improved access to care, especially in remote or underserved areas. Health data analysis. AI algorithms can analyze large-scale health data, such as population health records, to identify trends, risk factors, and patterns of disease outbreaks. This information can help public health agencies and policymakers make informed decisions about resource allocation, disease prevention strategies, and healthcare policy planning. AI ethics and privacy. As AI becomes more integrated into healthcare, ethical considerations and patient privacy protection become crucial. Ensuring transparency, fairness, and accountability in AI algorithms and protecting sensitive patient information are important challenges that need to be addressed. The responsible and ethical deployment of AI in healthcare is essential to maintain patient trust and safeguard individual rights. It's important to note that while AI holds great potential in healthcare, it should always complement the expertise of healthcare professionals and be used as a tool to enhance their capabilities rather than replace them. The collaboration between AI systems and human clinicians can lead to more accurate diagnoses, improved patient outcomes,